Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. Hello, and welcome back to the Mindful Practice Podcast. Today, we're talking about how coaching helps physicians heal burnout. And I think that this is a very important topic because coaching and what it does for physicians experiencing burnout is very crucial. And it's very important to understand the difference between coaching, therapy, and mentoring. Coaching is not therapy. Therapy is a confidential, professional relationship with a licensed practitioner designed to deal with past trauma, manage mental health conditions, and improve emotional well-being. Now, physicians with burnout may need therapy, and it is important to explore that, especially if you've been dealing with chronic burnout and you're dealing with anxiety, depression, PTSD. It's important to see your doctor and see a therapist for proper mental health treatment. Burnout can also lead to substance abuse. And so it's also important to seek therapy and treatment for that as well. Therapy is not mentoring. Mentoring is a long-term, often informal relationship where a more senior person shares experience and wisdom to guide a less experienced individual's career and personal development. As physicians, we've all had mentors who have helped guide us through our professional careers. Coaching is not therapy. It is also not advice giving. Talking to a colleague and getting peer support is great, but that does not constitute as coaching. Coaching is a partnership. Coaching is a short-term, structured partnership between peers, a coach and client, to enhance performance, build specific skills, and achieve future goals. While mentoring is career-oriented, coaching is goal performance-oriented. And therapy is emotional or healing-oriented. While mentoring is long-term, coaching is usually short-term and project-based, while therapy varies depending on your treatment needs. Mentors share their personal experiences. Coaches help you find your own answers. And a therapist uses clinical techniques to address deeper issues based in the past. It is important to understand the distinction between coaching, mentoring, and therapy, and because it helps you understand how coaching can specifically deal with burnout. Now, all of these modalities and tools can help you with your career, but each of them have a specific function. Today, we're going to focus on therapy and what it is not, and how it can be effective for burnout recovery. What coaching is. It's a collaborative, goal-oriented process that helps individuals build self-awareness, clarify values, make aligned decisions, create sustainable change. The client sets the agenda. The coach holds the space. Coaching is a peer-to-peer partnership where active listening and reflection helps a client or coachee define and achieve goals in their personal, financial, spiritual, professional, and physical aspects of their lives. Coaching can help you with career and leadership development, time management, skill acquisition, financial goals, personal relationships, and your overall health. Any aspect of your life. It is very future and goal directed. Coaching helped me to redefine my role as a physician and reinvent my career after a devastating illness. The coachee-coach relationship is similar to a pilot-co-pilot relationship. The coachee or client is the pilot who's trying to fly the plane to the final destination or goal successfully. And the coach or co-pilot helps provide direction to give the pilot insight on how to arrive at their destination and goal. Why coaching works for physicians. As physicians, we are trained to solve problems, not explore themselves. Coaching creates space for physicians to reconstruct their identity, gain permission to imagine alternatives, and have accountability without judgment. Burnout recovery is not about doing more. It's about becoming more honest with ourselves and being more authentic. Coaching assists with burnout recovery because it helps with identifying the root causes for burnout, such as overload, time management, administrative tasks. Coaching also helps with setting and communicating boundaries. As you know, physicians have issues with identifying, setting, and communicating boundaries that protect our mental health. Resilience building. Coaching helps develop sustainable long-term habits to prevent future burnout, such as self-care, time and stress management, and mindfulness activities, such as deep breathing and body scans. Coaching also helps with burnout recovery by realigning your values. Coaching helps you redefine success to match your personal values to achieve a more sustainable, healthier goal. Now it's time for some guided reflection. We've covered a lot of information about coaching today, but now I would like to do a guided reflection to help us determine and reflect and redefine and get some clarity. Take a breath. Ask yourself, why am I tolerating what is slowly draining me? What would sustainability look like in my life and career? What part of myself have I been ignoring? No fixing, no judging, just noticing. That acknowledgement is the first step towards burnout recovery, and coaching helps you define that. In coaching, there's no judgment. It is a safe place. There's no fixing because you're already whole and you have the tools and resources at your disposal to identify personal problems you want to fix in your life and to achieve those goals. Coaching just helps you obtain the roadmap to get there, just like in the pilot co-pilot example. What to look for in a coach? First, you should look for training and certification. A lot of good coaches have spent hours coaching and learning different frameworks to help their clients. This amount of training and hours spent coaching can lead to certifications, the most common one being ICF. You also want to look for psychological safety. You want to feel that the coach can provide you with a safe, non-judgmental space to be vulnerable and to be self-reflective, asking questions and pondering what you want to change in your life. You also want to look for a coach who is curious but not controlling. Coaches use tools such as frameworks to ask reflective questions that will help you define what you are looking for in your life. Coaches are not about control. The control lies with the coachee or client. You determine what you want to work on. Finally, a coach should respect your autonomy. The right coach does not rescue you. The right coach will help you unlock the keys and tools that you need to be successful on your own terms. That's part of the growth mindset. A belief that we can obtain skills that we need to become successful. The 4 C's of purposeful coaching include connection, building a strong, trusting relationship where individuals feel valued and supported. Communication, building a strong, trusting relationship where individuals feel valued and supported and can communicate their needs. A coach will also ask a lot of reflective questions, which will allow for self-discovery, which leads to more clarity, which is the 3rd C, which is providing clear goals, expectations, and direction. So once you identify what you would like to achieve, the goal or expectation, then you need to develop a roadmap or plan, a strategic plan in order to achieve your goals. The final C is consistency. Coaches need to deliver consistent support, expectations, and feedback to foster stability. This allows the coachee or client to achieve their goals and make progress. In order to determine if a coach is a good fit for you, it is important to set up a consultation with a potential coach. A coaching consultation is crucial for establishing rapport, defining goals, and determining the fit between a coach and client, acting as a foundation for personal or professional growth. It enables individuals to clarify objectives, identify obstacles, build self-awareness, and create tailored action plans to ultimately boost performance, confidence, and success. The coaching consultation offers, number 1, goal clarity and strategy, helping define those goals and establishing a roadmap to achieving them. Most coaches help clients determine SMART goals, goals that are specific, measurable, achievable, relevant, and time-bound. Once those SMART goals are defined, then you need to establish a strategy in order to achieve those goals. Next, the coach consultation should assess through reflective questions or targeted questions to identify the issues the client is facing. Usually that starts with a simple question as, what would you like to discuss? Or what obstacles or problems are you facing now that you would like to address? Those simple, open-ended questions start the self-discovery and reflection process. Next, the coaching consultation should build trust and rapport, ensuring a safe, non-judgmental environment is established, which is essential for effective, honest dialogue. A coaching consultation should also set expectations, outlining the coaching process, methodologies, and expected outcomes, ensuring alignment between the coach and the client and what each person's role is. A coaching consultation should also identify obstacles and challenges. Coaches help uncover hidden challenges, biases, or perspectives that may hinder progress. A coaching consultation should also involve value alignment. Consultations help align personal values with career or personal goals to improve overall satisfaction. A consultation acts as a proactive step to ensure that your investment of time and resources into coaching will yield tangible results. If this podcast resonates with you and you would like to learn more about my coaching services, visit pinnaclebusinessacademy.org or email pinnaclebusinessacademy@gmail.com to request an initial intake and schedule a 20-minute free consultation with me. Thank you so much for listening to the Mindful Practice Podcast. Until next time. Thank you for listening to the Mindful Practice Podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And If this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.